Hello and welcome to Medical Edge. My name is Todd Barnes. This program is produced as a partnership between the Mayo Clinic and the City of Thornton. We hope every episode provides you with valuable health information for you and your family.
I'm one of those guys that probably didn't see a doctor for 25 or 30 years until I woke up one morning with cancer. In 2008, I started having what we just thought was the enlarged prostate problems. All of a sudden in June of 2010, went into the doctor and my prostate situation had just erupted. My experience at the Mayo Clinic and specifically with Dr. Eugene Kwan has given me back a second chance at life. When I got here, I had but 3 or 4 weeks left to live, and right now I've got a long horizon again, and I'm living every minute to the fullest.
Basically, the cyclotron creates isotopes, and then the C11 isotopes are sifted out, purified, and then attached to a choline molecule. Now, a choline molecule is just a nutritional agent. And the weird thing is that for whatever reason, prostate cancer loves to eat choline. By placing the C11 onto the choline, it now can be seen by a positron device. It helps you hunt down this otherwise invisible cancer. So instead of waiting around for months and losing time, I think that we can make very rapid assessments in terms of how effective or ineffective a treatment is.
And that's what the C11 machine is all about. It's this really innovative technology that allows us to very precisely identify the emergence of very, very small locations of cancer. By being able to identify those early, we're able to attack them, we're able to kill them in one way or another, and we're able to keep it from growing.
The C11 PET scanner in one fell swoop has changed how we can interpret treatments.
So you've got a much greater opportunity for success. You've got a much lower cost of treatment. It's a win-win for everyone. Now I've still got cancer, and I will be fighting it for the rest of my life, but I've lived 3 of the best years of my life with the care of the Mayo.
For 12 years, this is the routine that Pete Generis has had to accept: kidney dialysis 3 times a week. As vital as it is, he admits it can wear a guy down.
I mean, even myself, I knew that, man, it's taking a toll on my body.
Pete has dealt with kidney disease most of his life, even receiving kidney transplants before. But this time was different. He was told he would almost certainly reject any donor organ.
Not many people understand, oh, you need a kidney, you get on the list, 2 years later, you get your kidney, you're fine. That's not the story for everybody.
About 80% of people who've had a previous transplant have actually antibodies against other tissue types. They also could have been exposed to the foreign tissue types by a blood transfusion or even pregnancy.
I was devastated, shocked, didn't really see it coming.
Pregnancy delivered a double blow to Anissa Swanigan. After giving birth a second time, her weakened heart condition advanced to heart failure, and complications scarred her liver so badly it was failing too. Doctors told her she needed a double organ transplant.
That's the only way you're going to survive.
She had 2 big reasons to survive: her 2 little boys. But again, high levels of antibodies made her a very poor transplant candidate. Antibodies are a good thing when they help us fight disease. Vaccines, for example, trigger our immune systems to create antibodies. But for some of those waiting to receive life-saving organs, Mayo Clinic transplant surgeon and immunology researcher Mark Stiegel says antibodies become the enemy.
It's a big problem. There are about 9,000 people on the kidney transplant list in the United States right now who have really high levels of antibody to the point that they can't really get a transplant.
Pete's in that category, called highly sensitized. So Dr. Stiegel and his team did a variety of things in advance to tip the odds in his favor. They carefully selected a living donor for which Pete would have the fewest antibodies. Also, drug research has found a way to reduce antibody-caused rejection rates from 40% to less than 10%.
One of the drugs that we were the first to use is a drug called eculizumab. If we give this drug, the antibody binds the kidney, but it doesn't cause the damage.
Pete also went through numerous rounds of an antibody filtering process called a plasma exchange. Then, to try to halt the production of new antibodies in his bone marrow, Dr. Stiegel turned to an FDA-approved clinical trial at Mayo Clinic using a powerful drug.
A drug called Velcade, which is actually used in the treatment of cancers of these antibody-secreting cells. But of course, these are not cancer cells, these are normal cells.
Anissa also underwent drug and plasma exchange therapies, but her antibody levels were so high, doctors worried her body might still reject the donor organs.
By the time the liver went in, the heart would already be irreversibly damaged by the antibodies. So we reversed the process and did the liver transplant first.
Why? Surgical Director of Heart and Lung Transplantation at Mayo Clinic, Dr. Richard Daly, says the liver filters antibodies. In combined kidney-liver or heart-liver transplants, his team had observed a reduction in antibodies to that donor. However, in multiple organ transplants, hearts generally have to go in first because their tissues are more time-sensitive. How does the Mayo team get around that?
Choreograph the whole process. We have to have the donor close enough by, we have to have the procurement done and be really completely ready for the organs when they arrive.
It seemed brilliant, brilliant minds that they collaborated and they got together and figured out how to do this thing.
And I took a chance. I didn't have anything else to lose, so either I stay on dialysis or a miracle happens and I get this kidney.
Innovation that makes a world of difference, one patient at a time. Mayo Clinic is world-renowned for its innovation in virtually all fields of medicine. Technology and science have led to discoveries capable of treating some of the human body's most challenging conditions. And increasingly, doctors and researchers are finding that a tiny collaborator can help them find the answers they seek. The zebrafish.
We have 80,000 adult fish in the fish room. We usually call it the fish farm. It's an aquaculture facility that is one of the best in the world. We generate up to 10,000 embryos a day for large-scale genetic and biological testing.
Dr. Stephen Ecker is a professor of biochemistry and molecular engineering. He is also director of the zebrafish research program at Mayo Clinic.
I think most people are surprised at how related we are to a small fish. We share the heart, we share kidney, we share pancreas, we share digestive systems, we share eyes and ears.
Which makes the zebrafish almost ideally suited for studying essentially any disease or physiological system, tissue, gene function, or biochemical process, such as addiction.
The number 1 and number 3 preventable causes of death and excess healthcare costs in this country are tobacco and alcohol, respectively, and we have programs in all those areas using zebrafish.
Only the laboratory mouse is more widely used by researchers around the world, but Dr. Ecker predicts zebrafish use will continue to grow. Fish take far less space, are easier to care for, and because they reproduce and develop rapidly, he says scientists may get their results faster.
The eggs develop externally, so you can see literally from the one-cell stage everything. The zebrafish is the premier model for understanding how we go from a one-cell early vertebrate to this rich body that we are.
One of the other beauties of the zebrafish system that we use is that it is a much more permissible organism for regeneration.
Dr. John Henley is studying how severed nerves try to repair themselves.
Do you grow straight? Do you make a right turn? Do you make a left turn to find their way to the correct target?
His team's research has uncovered some startling chemical signals that may one day allow severed spinal cords to heal and even reverse paralysis.
And then it allows us, instead of just making findings in a culture dish and then surmising it might be relevant in the animal, we can actually test it in the fish model and see if we can restore function.
To suit a wide variety of research needs, Mayo's program generates 5 to 10 novel lines of zebrafish strains each week. They're shared with fellow scientists all around the world.
I've learned a lot of things about zebrafish because I've been working with them since I was in 7th grade at Lincoln.
Even some very young scientists who've impressed the research community enough to have their findings published in the peer-reviewed journal Zebrafish, its youngest contributors ever.
One of the amazing new things we started about 5 years ago is a science education reform program called Inside Out, where we are using the zebrafish in schools. The goal is to really reimagine and rebuild science education. And here in Rochester, our lead school is now the top science school in the state.
So, whether the questions involve cardiology, neurology, oncology, genetics, aging, or regenerative medicine, at Mayo Clinic, medical researchers may find the answers swimming right before their eyes.
And I'm excited that the zebrafish is here at Mayo Clinic, really contributing to that understanding.
That's all for this episode of Medical Edge. If you're interested in learning more about any of the stories featured on this program, you can find additional resources by visiting our website and following the link to the Mayo Clinic. Thanks for watching, and be sure to watch the next episode of Medical Edge from the City of Thornton.